Good evening. You're watching CNN Daily News. President Barack Obama has always considered the reform of the healthcare system as one of the top priorities of his campaign, due to the ever-increasing healthcare needs and the cost containment pressures. There has been heated debate in the Senate over the proposed reforms, in particular the introduction of a public option. But just how beneficial will this public option be? Will it be the silver bullet that ensures healthcare to all Americans, or will it result in the government takeover of the insurance market? Albert Chang has this report.
To my progressive friends, I would remind you that for decades, the driving idea behind reform has been to end insurance company abuses and make coverage available for those without it. The public option is only a means to that end.
The current insurance market is highly monopolistic. This allows insurance companies to charge a high premium on the prices, and many Americans simply can't afford this. In 34 states, 75% of the market is owned by 5 or less companies. This has led to 30 million Americans losing their insurance and 14,000 losing their coverage every day. Now, to combat this, the public-run option will be much more affordable and aims to cover more people. To get a better idea of the impact of the public option, let's hear what economic analyst Kelly has to say.
Well, at the moment, traditional ideas of market structure do not apply to the insurance industry because companies mainly compete by risk selection and not supply and demand. In other words, they profit by denying coverage to Americans who have a high probability of getting sick. As a result, you get states that have 90% of the market share by just one company. And on top of that, the industry itself adopts a utilitarian policy, which means that they provide the greatest good to the greatest number of individuals. But the problem is it disregards Americans who are uninsured and, like I said earlier, those who need health care the most. It is not fair that the poorest and sickest people get to pay more than the richest individuals. But that's how the system works for the past 50 years in the United States. Now, by introducing this public option, insurance companies would be encouraged to cut down their costs and charge lower premiums, leading to a healthy competitive environment and ultimately providing affordable insurance choices to customers. It would also ensure equal access of health insurance for both rich and poor customers. Then there's the problem of rising costs. The public option would contribute to stopping this rise in 3 ways. First, since it will encourage insurance companies to charge lower premiums, they will be forced to cut down their administration costs, which contribute to 31% of the healthcare expenditure. Second, it will reduce fiscal expenditure because the insurance companies will charge very low premium rates. And third, businesses that purchase coverage from this public option can't afford to pay higher wages to their employees. Now, these high wages are taxed, and therefore this would generate government revenue from the income tax.
Despite its potential benefits, the public option scheme has been bitterly opposed in the House, and many opponents question whether such a plan is even feasible and whether or not the government should interfere with the free market.
If a public option is made available, it will most likely enjoy implicit or explicit subsidies. Such subsidies would prevent a public plan from providing honest competition for private suppliers of health insurance, seeing as it would unfairly compete with private plans by charging lower premium rates. Moreover, if the subsidies are big enough, more consumers will eventually be induced to make a switch, leading to companies declaring bankruptcy. Existing public health plans like Medicare and Medicaid are the reason for the government's long-term finances being a shambles. True, Medicare's administrative costs are low, but it is easy to keep the same contained while doing the exact opposite about wasteful medical spending. If costs of a public plan are kept artificially low, such a plan could rack up never-ending debt. In fact, the director of the Congressional Budget Office testified that inclusion of a public healthcare plan significantly expands federal government responsibility for healthcare costs in the long term, costs he termed unsustainable. If the government has a dominant role in buying the services of doctors and other healthcare providers, it can slash reimbursements. With the government enjoying a monopoly, healthcare providers will have little choice but to take what they can get, resulting in progressive decline in number of employees within the system. This could eventually cause job losses, which in turn would increase the unemployment rate. No wonder the American Medical Association opposes the public option.
The healthcare bill is currently deadlocked in the Senate, and with its future uncertain, it's unclear whether or not the public option will ever come into existence. This is Albert Chang, CNN News, London.
Now we have our international correspondent, Mr. DeCunha, to further elaborate on this topic. Mr. DeCunha, many people, including government officials, fear this public option and believe it will result in a government takeover. What are your views on this?
Although many fear of public option, history has shown us that public-private hybrids can coexist peacefully in a variety of industries. Take Fannie Mae and Freddie Mac, for example. These mortgage giants used to be private companies, but they are now under government control. Hence, Fannie and Freddie benefit from government backing of their debts. So in the same way, a public health insurance option would benefit from the presumption of a government backstop. However, it's worth mentioning that public systems aren't infallible and will have drawbacks. Take the UK's postal system, Royal Mail, for instance. Royal Mail has come under heavy criticism recently due to soaring losses, lack of modernization, and frequent postal strikes. This government-run system is slow and inefficient and hasn't kept up with modern communications technology. In contrast, privatized groups such as Germany's Deutsche Post and the Netherlands' TNT Post have diversified into parcels and express deliveries and have expanded abroad. As a result, they are more efficient, flexible, and better positioned to cope with falling demand. So the point here is that the US public option for health insurance mustn't fall into a similar trap of an inefficient bureaucracy that restricts innovation.
Mr. DeCunha, you mentioned a hybrid system in a non-healthcare context. Could this actually work in a healthcare context?
Absolutely, and to demonstrate this, I would like to highlight the strengths of one of the best-rated healthcare systems in the world, which happens to have a predominantly government-run insurance scheme. Healthcare in France has universal coverage, promotes patient choice, guarantees physicians' authority in clinical decision-making, has no waiting lists for elective procedures, and patients do not require pre-authorizations. At $3,500 per capita, it is also cheaper than in the US at $6,100 per person. This is partly explained by the lack of non-medical personnel payroll expenses that burden physicians in the US. France's national insurance plan, Sécurité Sociale, has a standardized and efficient system for physician billing and patient reimbursement using electronic funds, which is hugely cost-saving. Furthermore, private health insurers supplement the national insurance plan by covering expenses not paid for by Sécurité Sociale. In fact, nearly 90% of the French population has private insurance. Evidently, this public health insurance option has not driven out private insurers from the market.
That's all we have for today. Thank you for watching CNN Daily News. Good night.